Welcome back, everybody, to Wellness Wednesday. We've asked our health experts to stay with us to answer more of your health and wellness questions. So please welcome back Dr. Sean West from Premera Blue Cross, Laura Takas from Virginia Mason, and Dr. Sean Keller from Smiles by Design. Welcome to everybody.
Thank you.
I'd actually really like to start with Laura. We're talking about the intensive treatment that goes into helping people cope with a sudden loss. Tell me a bit about your background and how this technique to deal with this came about.
So the technique was developed by Dr. Edward Reinierson after the personal loss, after suicide, and he realized that there were not too many models way back then. This happened a number of years ago, that really addressed the traumatic part. There was a lot of grief therapy out there, but there wasn't a lot of work being done around the traumatic, the horror part of this particular type of death.
And you have worked with refugees, people overseas who've gone through a lot. Can you explain a bit about your experience?
So I've been trained in this model. I think I trained in about 2007, and I've taken it over to Jordan, where I was working with Syrian and Iraqi refugees and torture survivors.
Wow.
So I really had to culturally modify this.
But there is that commonality of loss plus trauma. How would you say this model of treating people is different from what we might have experienced as just, normal counseling or therapy?
Well, there are a lot of models out there that work very, very well with PTS. So I don't want to make it sound like we're the only model out there. Mm-hmm. But what we have, what I am finding is that by not only working with the trauma images that generally people, regardless of whether they've actually seen the death of their loved one, they make up a story, and the story can be more horrifying than what has happened. But we also look at the life of the person and really commemorate them, because they were much more than just their death, which can often really supersede the life.
Exactly. If that is so horrific, then maybe nothing else comes through. Interesting. Okay, thank you. I was just curious about the background. Dr. Keller, tell me a bit about the technology that you use. We saw the 3D images, that kind of stuff, sort of whiz bang. What is it that is behind that?
Well, it's the cone beam technology, the 3D images, and it's the records process of getting we call it the digital copy of the patient.
Right.
So we're able to build this 3D version from about here up of the patient, and we have their bone, we have their muscles, we have the skin, we have their original teeth. We know exactly where we're going to put the implants before we've done it, and so we can design the smile, and it's all not just there so we can place the implants. We actually have a CAD/CAM milling machine that will actually make any of the pieces that we design, and it does it in just a few hours.
How new is that?
CAD/CAM's been around for a while. For 20 years, I've been making individual little teeth. Like you scan the tooth and then it'll spit it out in about an hour. Now to do these ones that do this entire bridge out of a material like zirconia that can last a lifetime, that's where the big technology comes in, is that the machines can cut these things to that precision. That's
really amazing, and it's sort of like a 3D printing process in that way, but it makes something that's incredibly precise.
The 3D printing is acrylic, so sometimes for a temporary thing we'll do that, but the zirconia is something that it mills it in a piece that's bigger than the final thing, and then we sinter it at something like 80 gajillion degrees, and then it shrinks into this thing, and that's how it's like cubic zirconia, like the diamonds.
Wow. Stuff is, I mean, it's so interesting because it's the technology, the dentistry, the artistry, the sculpting, all of that put together. So let's talk about the FIT test that you mentioned, the at-home, the alternative to colonoscopy. How do people get this, and how do they get it covered by insurance?
Well, the best way is to talk to a primary care provider. They can explain the different options and if that's appropriate for you, and help to supply the test. And again, most health plans do cover this in full. In fact, Premera is actually sending out 10,000 of these kits to people that have Premera insurance. I was mentioning that for every 1,000 people that get screened, about 20 deaths are prevented. So theoretically, if everybody returned these kits, that's 200 people whose lives could be saved.
That's pretty amazing.
Yeah.
So if you ask your doctor, this can be sent to you. I keep seeing these commercials for these tests. That's what I'm wondering about. Is one better than another? Do you talk to your doctor? Do you just order one?
It's a lot of information, and there are differences between those tests, and so it's hard to discern. There are direct to consumer advertisements, and And that's way better than doing nothing. So if that's the way you want to do it, then that's fine. But I always think the best thing is to talk to your provider so you really understand the differences, the pros and cons, and what your options are specific for your needs and your history.
And your history, so that's part of it. You're not going to do that with something you bought off a telemarketer. You're going to be doing that with your doctor where you go and do that.
Right.
What do you find sort of gets people motivated? Because that's what we want to do with this. We talk about these screenings a lot, and what we want to do is get people off the couch.
Yeah, I think everybody's a little different. Some people can see the value in that it's a great opportunity to do something that can save their life. Other times, especially for us guys, maybe you talk to the fact that it's for your family and that you need to be there for your family, and you would feel really silly if there was something simple that you could have done. So I think, you know, appealing to the fact that you're doing it for your children or other people, I think that helps.
Which works for a lot of things if we think about things we're doing for our kids.
Absolutely.
That's terrific. And one last question for you, Dr. Keller. What are you seeing in terms of psychological boosts for people who get new smiles and get their health taken care of?
Well, I'd say that they, when people are embarrassed of their smile, they don't show it very much. And other people that see them take that as maybe they're grumpy or maybe they're just an angry person. And it's, I've had a lot of people get a new job. They've been interviewing and it hasn't gone well before, and now they come in and they're just smiling. And it just like people want to be around other happy people.
That's a, you know, that's a thought too. And that also is a reminder not to judge people in that way, because you never know what's going on with somebody else. But thank you for the work that all of you do. We'll be back in just a moment.